eh.
Okay. Yung drug regulatory board, that is common. And how is that going to bother the doctors?
No.
The drug regulatory board, because
No.
you're not into
We
you're not
lower
into
the price
drugs.
of medicine. We are into it.
You're okay there.
Yeah.
But the thing that I think gets the goat of the doctors is when people started coming out, or news articles referred to the reason why the price of medicine is as high as it is, the branded ones, is because of the perks the doctors get from these pharmaceutical companies, sending them to conventions and paying off for their travel and their hotel stay. Is this a reality that doctors enjoy, being doctors and being given these special privileges by drug companies?
I myself, being an officer of the PMA, haven't received any plane ticket or any perks from the drug companies. But I think there are some. And in our code of ethics...
Is this against your code of ethics?
It's no gifts, no incentives. It's a violation of the code of ethics, the medical profession, even drug companies. And once we have cases like this, I think should be brought to the attention of the PMA and also the PRC.
And have you ever received an attention, calling your attention to some doctors who have actually been wined and brought to conventions and paid for, not just them, but even their spouses to join these conventions abroad?
We haven't received complaints even from doctors itself and even from drug companies.
Of course, the doctors won't complain.
But when hearings, in several hearings, may hearings sa Senate, sa Congress, at merong time na they had a list of expenses incurred by several drug companies. Ang percentage daw nila sa promotion sa doctors only 2 to 3%. Actually, ang malaki ang bulk ng kanilang overhead is for the distribution and the discounts being given to drugstores. Mas malaki dyan ang napupunta kaysa
So you're telling us that the cost of marketing or maintaining good relations with doctors just constitutes 2%?
2 to 3%.
2 to 3% of their total cost for the drug?
Yeah, it came out when we asked them how much really goes to the doctors.
Do you think, as a doctor, Yusek, and you as a doctor, Congresswoman Garin, is the drug company able to monitor how you, as a doctor, what was your field?
Well, I'm not a
GP.
diplomat because I went into politics, but I trained in obstetrics.
Okay. Would the drug company that provides medicines for obstetrics and your field of work be able to monitor your actual prescription at the point of sale?
In one way or
is there
another,
a whole science already developed by the drug companies where they can monitor your prescription? And whether these people actually, your patients actually buy the drugs that you prescribe. Meron bang ganun?
The only thing that I can tell you, Filipinos are very innovative.
You're talking on the Filipino drug companies or the doctors themselves?
Well,
the
even
drug stores?
multinational companies have Filipino employees. So if
But
you
there
ask
is
me,
a way. I can imagine there must be a way.
May I?
it's like this.
Yes,
no?
yes.
If I'm having clinic in this area, there would be a pharmacy nearby.
Just check.
It's you can check the quota because there's a quota system.
Do the drugstores keep the prescription?
Sometimes there's a duplicate, and they keep the
So they
prescription.
can actually monitor whether you,
Yes.
Dr. Cayetano...
You monitor like the extent of sales. You cannot really, I mean, somehow in one way or another, merong date, merong like, there's a duplicate, a triplicate.
Yeah.
Now, on the issue of 2 to 3% being spent, well, I am not an owner of a pharmaceutical company, but if I were a salesman, and the people prescribing my, or let's say the people who are the primary users of my products, I wouldn't budget 2 to 3%. Because if you talk
Higher.
about marketing, it's the bulk of what is being used. Now,
It's the doctor. It's the doctor, which is the point of sale, actually. You wanted to include something.
No, I just wanted to add that a doctor, a very respectable doctor, in fact, told me that one of she knew a representative from a pharmaceutical and comes up to her and says, Doctor, you're not using our drugs. Like, how do you know? Alam mo, monitor po namin. And yeah, and she's very outspoken. She's like, yeah, I don't use it because I don't believe in your drugs. Ginano niya. So, they had a way, rightly or wrongly, they attempt to follow, no? So,
So there is a science already.
Well, ang
Yusef
alam rin ho
Padilla.
namin is that the pharmaceutical companies actually allot a certain amount, if not only
Higher
for
than the
promotions,
3%.
but for advertisements. Pero simpleng-simple lang ho ma-determine yan eh. If you check the same product that they have here in the Philippines, ikumpara ho natin yan sa India, Pakistan, o Thailand, o kung ano man bansa, exactly coming from the same company, ang
With the same
presyo,
brand.
same brand, ang presyo ho, ang laki ng kaibahan.
which is why I go back to our position in the Senate, which ito yung key, yung parallel importation. Kaya doon kami nakafocus.
No,
Okay. 1 minute. The final stretch of talk back in a moment. Stay with us, please.